All right, hey guys, welcome to our live at 5:20. This is Dr. Abraham at Valencia Medical Center, and we received some of your questions. A lot of people are interested with PRP hair rejuvenation, so we are doing some PRP hair questions today. We're actually doing a treatment right now with PRP hair. We already numbed the client, and her blood is spinning, so we'll let you guys join us for that in a few minutes so you guys can see like a live demonstration of the treatment. But basically what PRP hair, for those who aren't familiar with it, it's a treatment that's done for to help with hair growth. So it's for people who are suffering from thinning hair or are starting to lose their hair, and they just want something to help rejuvenate the hair and restart the hair growth cycle. So the way we do it is we start by taking your own blood to kind of get the platelet-rich plasma out. Once we concentrate the platelet-rich plasma, we inject that where the hair follicles sit, and that just kind of there it releases the growth factors, the cytokines, brings in other healing cells to the area basically, and it just helps with regrowing and nurturing that hair cell. So it helps with thickening the hair that's been thinning over time. It's also a way to help prevent hair loss or help like decrease or stop hair loss depending on the each individual person's situation. It's great supplement and sometimes alternative to hair restoration, like hair transplant. So a lot of people who do hair transplant, they do the PRP treatment to help kind of augment and really make that treatment work a little bit better. But it can also be used sometimes as an alternative in the right clients, of course. We already have started the process for somebody inside, so we already have the hair from one of our clients, and we already got the blood, I should say, from one of our clients for the hair treatment. It's being processed right now in the back, so we should have the PRP very, very soon. And we already started numbing the client. We do numb the area with lidocaine and epinephrine, and that makes it a lot easier, and it really helps with minimizing any pain from the procedure. So it's a very tolerable procedure. And just some of the questions that I have here that you guys were submitting over the time. The first one is, what should I do before PRP treatment for the hair? And really there isn't much. The main thing is to kind of come in without any products in your hair. So we ask you to wash your hair or shower that morning, and just kind of like leave your hair alone. You don't want to apply any products, whether it's spray or gel or anything really in the hair. When you come in for the procedure, we want to start obviously with a clean scalp. We clean the hair a little bit here, and then we go ahead with the treatment. You want to avoid Advil, aspirin, Aleve if possible, if it's okay with your doctor. Because these can thin your blood and make you a little bit more prone to bruising. Sometimes you might get some small bruises on the scalp. But other than that, there isn't really much that needs to be done. Drink a lot of water, come in hydrated. That's always a good general advice, generally speaking. Yeah. All right, let's go to a second question. How many times should I do PRP for hair? So that's a common question. How many times should you do PRP for hair? And it really varies from client to client. It really varies from kind of depending on the situation, how much hair loss there is, and what other factors are playing. A general kind of rule of thumb is usually starting with 2 or 3 treatments initially, about 6 to 8 weeks apart, and then following up with once yearly maintenance treatment. But again, it could be once every 9 months, it could be once every 1.5 years for maintenance. So it really depends on each person. They're telling me that the actual PRP is ready for our next client. So we are gonna go and kind of start the PRP injections. You guys just missed the numbing part, but the actual treatment, once we get the blood processed, is pretty easy and simple. You guys should be able to see that right now. We're just gonna grab the platelet-rich plasma. Perfect. So We got about like 35 to 40 cc's of blood from the client, and this is how much PRP we have. We have about 3 cc's of platelet-rich plasma there. So as you can see, it's a little bit less than 1/10 of the volume of blood that we get. We end up processing in platelet-rich plasma. All right, I'm just gonna grab that. Hello again.
Hi.
All right, if it's okay with you, we're just gonna show some of it on camera. And I know we are going live, so if anybody has any questions, specifically, they can always ask us. Basically, we already numbed the client's scalp in this case, and just ready for the injection at this point.
Okay, doctor, so how long after doing this treatment will you see results?
So it really does depend. How long after the treatment do you see results?
Yes.
So it can take a couple months to see the full effect a few months to see the full effect of the treatment after getting it done. Usually after a few weeks, sometimes people like after 6 weeks or so, you might start seeing some minimal results, but really the full effects of the treatments are going to take a little bit longer. All right. So we're just going to be injecting right now.
All right, and then it looks like that somebody may have a skin disease of some kind, like psoriasis or something. Would they be a good candidate for PRP?
Well, it'll depend if there's any kind of inflammation or any breakout in the area that we're treating. But if there's just having, generally speaking, like dermatitis or psoriasis or something, does not exclude you from being a good PRP candidate. So yes, you can do it. Now, of course, if the inflammation or the breakout is in the same area that we're doing the treatment, we'd have to look at that and consider it. We already did kind of like numbing. We numbed the whole field, but sometimes there's an area that might still be a little bit more sensitive. So if you do feel any area that's a little bit more sensitive, just let us know. We'll add a little bit more numbing there. But other than that, you are doing great.
How long does this treatment usually last? Does PRP last for hair loss?
Kind of has to do with what we were saying earlier. Everybody's a little bit different, but most people, once we get them to where we want them to be, we kind of recommend the maintenance treatment that could be once a year, could be once every 15 months, or once every 9 months, depending on each client's case. But it averages, the maintenance treatments tend to be once a year. But age, all the other factors, everything plays a role, to be honest.
So kind of leading into the next question, how many treatments do you recommend, maybe including the maintenance?
So initially, this might be a little bit more sensitive. Initially, we recommend doing 2 to 3 treatments. And
Okay.
initially, we recommend doing 2 to 3 treatments, and then after that, kind of go into maintenance treatment. But again, we'd have to look at you and see. Everybody's different. It doesn't hurt to do more. If someone wants to do even more than the 2 or 3 treatments, they definitely can. Because this is your own blood, so it doesn't. We're gonna start going to the other side.
After a treatment is done, somebody's asking how long until you can wash your hair?
So, we usually wait like 4 to 6 hours afterward. So most people, we just tell them to wash their hair at that night, right before they go to sleep.
And then as far in that, it kind of goes along with the recovery period. I know that there's certain, do's and don'ts.
There isn't a lot of downtime with the PRP, to be honest. So The main things in terms of is kind of avoiding products in your hair, avoiding wearing a hat or anything that's gonna cause like mechanical stress. So these are the main things that you want to avoid.
For how long?
Just for initially the first 4 to 6 hours, kind of the most important.
Right.
But even the next day, you still want to avoid products in your hair if possible, depending on. And things that can like NSAIDs and stuff. I'm just gonna put some in the back here. We're actually almost done. As you guys can see, this is pretty quick once we get started. The things like NSAIDs and stuff, which are the anti-inflammatory, including aspirin, ibuprofen, Advil, Aleve, you want to avoid for a few days after. Alright.
And why would you not want to put product in your hair right after? Is it because you've got the needle pokes, or what's the process?
Exactly, that's definitely part of it. With all the needle pokes, the skin is open, the skin is broken and it's open, and can definitely cause an infection. We don't want these needle pokes to get where the skin is broken to serve as an entry to any kind of like bacterial or infection or anything like that. So it's better just to kind of keep the.
But shampoo and conditioner and that is okay? Is it because it's?
Well, that's why we ask you to wait like 4 or 5 hours before also even washing your hair and stuff. Because after 4 or 5 hours, most of these kind of needle injection points have started to close down pretty well.
Okay.
How are you doing? You doing okay?
I'm good. I don't feel anything right now.
Perfect. This
We're
is you've had a couple treatments before, so this kind of get used to it after.
Yeah. The first one was a little tough for me because I didn't know
what to expect.
Yeah. But this time was easy, I would say.
Yeah. How have you felt after each procedure? Has there been anything?
Oh, I think when the numbing goes away, I feel like normal. Your head is kind of a little sore when you touch it, but other than that, it's like normal. Nothing special.
Yeah, exactly.
I never had to like really take Tylenol after the treatment because it was normal.
That's good. No headaches or anything like that.
Nothing.
That's great.
No.
That's what we like to hear.
Yeah.
All right. Do you have any questions for us?
No. I think so. Yeah, this was my last treatment. Do you think I need more, or is it?
So probably, and for you, I would recommend like maybe in another 4, 5, 6 months do another treatment.
Mm-hmm.
Just kind of let it, give it some time to kind of get the results from the treatments that we've done so far, and then maybe in like 4 or 5 months do one more, and then after that like once a year.
Okay, so once a year you would recommend like.
Maintenance, yeah.
Okay. I don't have any more questions.
Perfect. All right. I'll thank you guys for joining us, and thank you for
You're welcome.
allowing us
Being
to
a part
do
of our
this.
Live at 5,
Appreciate
yeah.
it. If you have any questions, just send us a DM. Thank you.
Great.
Bye.